I'm going to be explaining what active modulation therapy is under the umbrella of the Diamond method, along with Diamond Active Massage. So I do have another video. You can find that with my brief introduction to what Diamond Active Massage is for the best damn pain and stress reduction on the planet. Active modulation therapy originally was called active myofascial therapy. We changed the name in 2018 to reflect what we understand about how we are addressing people's pain, limited mobility, all that good stuff. So we want people to have fun. We want people to be able to move with ease. We want people to enjoy being in their body. And the beauty of active modulation therapy is it does allow our clients to experience movement right on our table. So one of the most important things I want to emphasize is that active modulation therapy, the client or patient is active. And that's the difference between many traditional approaches to therapy. Massage therapy, chiropractic, acupuncture, cupping, scraping, dry needling, all the stuff is passive. The client's on the table. The client is passively receiving the work. The client is waiting for us to fix them. In Diamond Active Massage and Active Modulation Therapy, we're co-creating the results. The clients and we are working together to take them from where they are to where they want to go so they can improve easier movement and reduce pain. So one of the most important things that I want to pay attention, you to pay attention to is the client is clothed. We have them wear exercise clothes, something they can move in. They're not on the table under the sheets. You typically won't be using lotion, which saves on laundry and is so much easier. And the client's moving, so they may come in, you may work with them seated. I like to start with my clients seated because why? Gravity is affecting them in this position all day long. So we can look at their body, we can notice how they're sitting, how they're moving, where their head is, for example, in relation to their torso. All of that gives us a lot of information and valuable feedback that we can then help use to help them experience more ease. So it's active movement that the client is doing while we're applying manual pressure to their tissue. And with AMT, the client is also instructed to do different movement patterns. So it activates some muscles while it's stretching other muscles. And so there's a series that I'll mention in a moment of what we call actions. Um, the Diamond method is the umbrella term for both Diamond Active Massage and active modulation therapy. And it takes a different type of client. The client who we usually see is someone who does not want to just lay on the table and be fixed. They want to co-create their results. They want to be an active participant because they realize that by them doing some of the work, air quotes, but it's true, they're being involved. The results are longer lasting. They usually come much faster. They're much more comprehensive because we're not just working on an area, a spot area of tissue. We're incorporating their whole nervous system when they're being active participants with us. With AMT, we follow a 7-step success framework. 7 steps, DIAMOND. What a coincidence that it happened to match the letters of the method and my last name. But it actually does work. It's pretty cool. So, for example, each of the 7 letters represent how we interact with our clients and our patients. And it's a framework. So obviously each client is different, each session is different, but it gives you a guideline of what to do in each session. So there's no guesswork anymore. I mean, you're going to personalize it, of course, but for example, step 3 is DIA. So A is activating the area with actions. So before we put our hands on them, we are having them go through a certain movement pattern. That allows us to assess the quality of their movement. That allows us to watch. Are they hesitant? Are they guarding? Is the range of motion limited or maybe it's excessive? So that gives us feedback, that gives us understanding. It helps in the assessment process of what this client may be presenting with. So it helps us understand a cleaner picture than if they're just sleeping on the table. We have no idea what their ability is to move. So the 7 steps helps us understand the framework of how we go through the session so we don't forget anything. The goal of our therapy is always going to be based on the client's presentation and what their clinical goals are. So it's usually a combination of reducing stress, just emotional pain, emotional stress and pain, and then the physical pain. We work to elongate or stretch restricted tissue where needed. We activate muscles through movements like PNF stretches and things like that. So we're contracting, and the opposite effect happens, right? If we contract the back muscles, then it'll open up through the front. So this all helps the client reestablish movement patterns. It helps them feel more comfortable moving. If they had been injured, say, for example, in a car accident with whiplash, many times your client will present with hesitation to move their neck or to move their shoulders. We can start facilitating their comfort in moving by taking them through these actions, whether we're touching them or not. So one of the beauties of an AMT session, which a lot of therapists appreciate, is it's not requiring them to always be pushing on the client. It gives us the ability to be more of a guide, a consultant. You're helping the client understand what's going on with their body, and we are facilitating, we are supporting their ability to move, to interpret the sensations, the feelings that they're experiencing. And by doing so, for our position, it becomes much less physically demanding. It's oftentimes way more mentally and cognitively demanding. So not everybody wants to do that. A lot of therapists don't want to do it. They want to just zone out and provide a massage, which again is fabulous for the right type of client, for the right type of practitioner. What we find is that the providers who really enjoy working with clients through active movement therapy and with the manual component is they're the ones that like to do the problem solving. They're the ones that want to think about what's going on with the client and strategically help them create not only results from that one single session, but create a therapy plan. EMT can be provided by anybody who's licensed to touch. Now, there are home care exercises that we suggest clients do. If your scope of practice allows you to do that, then obviously you can incorporate that as well. So it's lotion free, like I said. The client wears exercise clothes, so it's easy for them to move. Less lotion costs, less laundry costs. The client gets up, gets down, seated on the table, moving around. You watch them walk, you do all sorts of stuff. Again, based on your expertise, based on your training, you can combine it beautifully with active modulation therapy. So real quick about the numbers, there's only 6 manual strokes that you need to learn, and that can be applied over their entire body. We already talked about the 7 steps of the Diamond Success Framework. There are 8 directives. So in Diamond Active Massage, there are what we call the simple 6 directives. So again, I explained the corkscrew. This is the movement. That's one of the directives. So we can hold an area and have them do the corkscrew while we're applying manual pressure. So there are 6 directives in Diamond Active Massage. There are 8 in active modulation therapy. And then the last number is there are 22 core actions that we use throughout the session and then again suggest as home care or homework. A simple approach to learn. It's a very profound interaction with our clients. Their experiences, they come out of it usually saying, why have I never heard of this before? Why has no one ever done this with me before? And the reason is because, again, it's a biopsycho approach where we're using their brain, we're using the interacting with their tissue, but the results are coming from their personal experience. And when we can be that guide and focus on what they're able to do, the good things, not the bad things. Too often they're going to a therapist being told what they can't do, focusing on their limited range of motion or their inabilities. And we focus on always, it should feel helpful, never hurtful. It should always be focused on what is possible for them. So again, the aim is reducing pain, increasing mobility in their joints, lengthening tight structures, and then the relaxation is a byproduct of the experience. And people walk out saying, "Oh my gosh, I feel so much better." So I hope that this has been exciting for you to hear. I hope that it's piqued your interest. I would love to invite you to learn the Diamond Method, either Diamond Active Massage or Active Modulation Therapy. And we are looking for educators as well. So if this sounds exciting to you and you want to be a part of it, I would love to help you take your practice to the next level and become one of the most impactful manual and movement-based therapists in your city.